trip to the hospital is no one's idea of a good time, but there are key things you need to know before heading to the ER. So here with tips to maximize your treatment and your time, please welcome emergency room physician Dr. Adrian Heller.
Thank you for having me.
If you've got to make that choice to go to Emerge, it's, you know, you're probably going to be there for a while. Think about what you're going to pack and take with you so that you're completely prepared. What do you suggest we need to bring with us if we've got to go?
So it's tough, right? I mean, I agree with you that no one wants to go to the emergency room. We see people on some of their worst days, unfortunately.
Right.
But there are things you can do to make your life a little bit easier, to make our life a little bit easier, to make sure that we're treating you as best as possible.
Yeah.
So the first thing I always suggest to patients is to bring a list of your medications.
Yeah.
Even just like a wallet-sized card.
Yep.
Write down the medications that you're taking, especially as they're updated with your family doctor. If a specialist puts you on a new medication, write it down there. We can usually pull up some medications that you're on, but it doesn't give us all the details all the time, especially if you're on something new. Say you are having respiratory symptoms, you're having trouble breathing or something, and the doc thinks you have a pneumonia.
Right.
They put you on an antibiotic, but then it doesn't quite go as well as you expect. Then you come see us.
Got it.
In that scenario, knowing which antibiotic maybe you were put on is very helpful. So bring either a list of your medications or the actual medications themselves to make sure that we can say, yeah, you've been taking this the right way. Can be super helpful.
So this is the sort of thing you should do in times of wellness, right? So that you're not stuck when you're making that. It's usually a last-minute rush to the ER. So if you've got that list going on, you can bring it with you anytime you go.
Yeah,
we're going to talk more about what you need, but I want to talk about the fact that you actually made your own switch career-wise.
Yeah.
You were not always set to be a doctor, an emergency room doctor.
No, not really.
What were you going to be? What were you studying?
So I was a big time math nerd leading into it, and I say that with all the good things that come with it.
Yeah.
Go nerds.
Yeah.
Math contests, chess club, the works.
Oh, I love it.
Yeah. So I went into engineering.
Yes.
I was a mechanical engineer. Did that at Queen's University.
Yeah.
And then I took a year to sort out what I wanted to do with myself. Decided I wanted to be more kind of people focused than machine focused, I guess.
Yes.
And yeah, went into medical school, went to family medicine, went to emergency medicine, and started working as an emergency doctor.
That's a pretty good switch from mechanical engineering to doctor. Like, these are all good career paths for you.
It was a bit of a change. Yeah, it was a bit of a change.
And is it giving you what you want in terms of like that public facing role? You're with people.
Totally.
Yeah.
I love it. You know what? I really get to see, at the end of the day, I get to see people on their worst days and help them through that day.
Right.
That's a pretty valuable experience. So I really do love that.
You've got to be a people person to be in your line of work. So that's amazing that you are, because not all doctors are, right? Okay, so you've got your list of medications. You say you also need to know your medical issues. What do you mean by that?
Yeah, so this comes down to that prep work again. So when you come to the hospital, we see people in all severities of illness.
Yes.
So, and knowing what your past medical issues are helps us reveal kind of what's currently going on for you. So same goes for if you have heart issues, if you have a history of any
like
any bleeding, exactly.
Or, yeah.
Other medical issues that have been going on, having a running list of that and being able to bring that with you gives us a good idea of what's been happening for you.
Okay.
Especially if you're maybe seeing a specialist, things are getting updated, there are changes going on in your medical history. They can always write down those fancy words that can be really difficult for you to remember.
Yes.
Hopefully in a legible handwriting.
I was going to say, with the way you all write.
My handwriting, pristine. I mean, wow. So no, it's the type of thing that it also comes at prep work. Your medications, your medical history can be very helpful to bring with you.
Okay. So speaking of that, you're saying also note and print off your lab tests.
Yeah, so
if you can.
If you can, and it gets a little bit tricky, but basically say you're seeing your family doctor, say you're having abdominal pain, for example. It's not so bad, you want to know what's going on, you see your family doctor about it, maybe they get an ultrasound for you.
Yep.
Then all of a sudden your pain gets worse and you say, you know what, I can't wait for my next visit, I need to go to the emergency room, figure out what's going on here, maybe there's a surgical issue. If you can bring your ultrasound result with you, that can either save you that test being done, it can direct us towards maybe what the diagnosis is sooner.
Yeah.
It can direct us to a different test. So it's very helpful for us to know what's been done previously.
Okay.
Sometimes there's access to certain results, sometimes there's not. So that can be really helpful for us.
Bringing someone with you is also a tip you give us. And when would you do something like that?
So, very often, actually.
Okay, always, if
especially,
you can.
Yeah, I mean, it depends on the scenario, obviously, but there's kind of two times that I would say particularly. One is, say your English is a second language, and you're worried you're not going to be able to communicate as best as you can what's been going on with you.
Yeah.
Now, we almost always have a translator service available in one way or another, but say you have a family friend or a family member who speaks English better than you, who you think could help you out, certainly bring them along. That can be very helpful. Now, another side of that is with elderly patients, unfortunately, when elderly patients get sick, there can be a little bit of confusion that can set in. Now, that means if your parent is going to the emergency room, then maybe it's helpful for you to go with them. Or if you're an elderly patient, go and bring a close friend of yours or bringing someone who can help advocate on your behalf.
Right.
Make sure you're getting an accurate history.
Yes.
Also, when we discharge a patient, there's a lot of instructions that get given out. There's a lot of, and we want to make sure it's safe. You know, we want to make sure we're not giving you a plan that's just going to fail and we're going to see you in 2 hours. So having someone with you can make sure that we're facilitating that in a way that is safe, is remembered, and fits the patient.
Really good, Dr. Adrian Heller. The last thing you say is bring something to do. You might be there for a while. Thank you so much.